Historical Overview of U.S. Healthcare Delivery by Professor Tammy. Historical Overview of U.S. Healthcare Delivery, Part 2.
American Medical Association, also known as AMA. AMA galvanized the profession and protected the interests of physicians. So what is organized medicine? It is the concerted activities of physicians through the AMA. AMA gained power by controlling medical education. AMA supported states in establishing medical licensing laws. AMA discouraged employment of physicians by hospitals and insurance companies because at this time working at hospitals was looked down at. Doctors were always discouraged to seek jobs at private corporate companies. Instead, doctors were encouraged to have their own practices. Educational reform. Advances in medical science made it necessary for the reform of medical education. Around 1870, medical schools began affiliating with universities. Harvard University revolutionized medical education, adopting the European model. So the academic year went from 4 to 9 months. Medical instruction went from 2 to 3 years. Labs and clinical courses such as chemistry, physiology, anatomy, and pathology were added in. Johns Hopkins opened in 1893, so a college degree was an entrance requirement. Medical training became a graduate program. Residency training was added in. The Flexner Report pointed to the widespread inconsistency in medical education. So the Council of Medical Education, created by the AMA, they started accrediting medical schools. This standardized medicine more, which is a good thing because you start knowing what your doctors have learned, at least the basic foundation. Development of hospitals. The growth of hospitals came to symbolize the institutionalization of healthcare. Advancements in medical science created the need to centralize expensive facilities and equipment in an institution, such as hospitals, equipments, and technologies were expensive, especially when they first come out. If it's been out for a while, then it gets cheaper because people are able to make more of them too. Hospitals and physicians depended on each other. Professionalization of nursing improved hospital care. Reform of mental health care. At the turn of the 20th century, federal policy promoted education, research, and psychiatry. In 1960s, concept of community mental health and deinstitutionalization. It shifted to community-based mental health services. This started a better understanding of mental health. History of health insurance. Private health insurance is also called voluntary health insurance. Publicly financed health insurance like Medicare and Medicaid were created to meet the medical needs of the elderly and the poor, respectively. Think Medicare as you're caring for someone, and think Medicaid as you're helping someone, you're aiding someone. Workers' compensation is the first broad coverage health insurance in the United States. So originally, the workers' compensation was designed to make cash payments to workers for wages lost because of a job-related injury and disease. Later, this became compensation for medical expenses. Eventually, death benefits for survivors were also added. Emergence and rise of private health insurance. During the 1900s, medical treatments and hospital care advanced, but medical care also became more expensive. So think about, why would this be? People could not predict their future needs for medical care or its cost. Hospital plan and birth of Blue Cross. Blue Cross is the hospital plan, while Blue Shield is the medical doctor plan. So think of the hospital with a cross on it, so you can think of Blue Cross. And then think of your medical doctor as your knight in shiny armor, whether it's a female or male knight. So they're wearing a shield. So this way you can memorize it better for the exam. The Great Depression made hospitals economically unstable. Individuals faced the loss of income from illness and the debt of high health care costs. In 1929, Justin Campbell began a hospital insurance plan for teachers at Baylor University Hospital in Dallas, Texas. It became the model for Blue Cross plans across the country. The American Hospital Association, AHA, supported group hospital plans and coordinated them into a Blue Cross network. Remember, Blue Cross Hospital Network. First physician plan and the birth of Blue Shield. In 1939, the California Medical Association started the first Blue Shield plan. It was designed to pay physician fees. By 1974, Blue Cross and Blue Shield merged, so they got together, became one. Today, they are a joint corporation and are in almost every state. Blue Cross Blue Shield is decentralized, so it is determined by the state you live in, so it's based on state. Employment-based health insurance. During World War II, employees accepted employer-paid health insurance to compensate for the loss of raises. So instead of getting raises, which that can kind of cause inflation, employers gave health insurance instead. Health insurances were offered in replacement of raises. If people receive raises, then there will be inflation, which will have hurt the economy, especially during wartime. So Congress had wage freeze, no increase in salaries. So you have to make it more attractive, so they added health insurance. The U.S. Supreme Court ruled in 1948 that employee benefits were a legitimate part of union management negotiations. In 1954, Congress made employer-provided health coverage non-taxable. This was equivalent to getting more salary without having to pay taxes. Think about it. When you go for a job, you're not only looking at the salary that you'll be getting, you're also looking to see if you're going to get health insurance. National health insurance. You can look into your book, Exhibit 3.5 Reasons Why National Health Insurance Has Historically Failed in the United States. Unlike in Europe, national health care failed to get an early footing because of labor and political instability in the United States. The decentralized American system gave the U.S. federal government little direct control over social policy. So, what's the difference between decentralized government and centralized? Centralized government is like directions are coming from one place. Like just think from Washington, D.C. Decentralized, it's coming from different places. Each place has kind of like their own rules. Like states have their own rules, so that becomes more decentralized. The German social insurance system was denounced during World War I. Since then, the term socialized medicine had been used as a synonym for national health insurance. The AMA, American Medical Association, opposed national health care initiatives. Middle-class Americans have traditionally espoused belief in values that are consistent with capitalism, self-determination, and distrust of big government. Middle-class Americans have been averse to higher taxes to pay for the increased cost of national health care program. Creation of Medicaid and Medicare. By 1965, private health insurance was the only widely available source of payment for health care. It was available mostly to middle-class working people and their families. A three-part program was adopted to serve two distinct populations, Medicare Part A and B, and Medicaid. Medicare Part A was designed to use Social Security funds to finance hospital care. Medicare Part B was designed to cover physician services through government-subsidized insurance. The elderly will pay part of the premiums. So think about it. Part A is hospital, Part B is physician, from big to small. Creation of Medicaid and Medicare. Although adopted together, Medicare and Medicaid reflected sharply different traditions. Medicare was upheld by broad grassroots support, and being attached to Social Security had no class distinction. That means whatever your income level is, you're qualified for Medicare. Medicaid benefits vary from state to state. It means tested and confines eligibility to those below a certain income level. So the more people in your state that has below a certain income level, the more money you will receive from the federal government. Medicare has uniform national standards for eligibility and benefits. It covers anyone over the age of 65. In 1972, the program was expanded to include the disabled on Social Security and those with early stage renal disease, ESRD, regardless of how old they were. So it didn't matter what age they were. The Medicare and Medicaid programs are financed by the government. Beneficiaries receive healthcare services mostly from private hospitals, physicians, and other providers. There is also broad financial impact. So the creation of Medicaid and Medicare. So you want to know the difference. In the book, Exhibit 3.6, comparisons between Medicare and Medicaid. Medicare covers all elderly persons, non-elderly disabled persons on Social Security, and non-elderly persons with end-stage renal disease. No income means no tests. They don't check the income. No class distinction, whether you're poor, rich, or in between. Part A for hospitalization and short-term nursing home stay. Part B for physician and other outpatient services. Part C for managed care. And Part D for prescription drugs. So Part A for hospitals. Part B for medical care. You see your doctor. Part C, your the eye doctor and the dentist. Part D, prescriptions, your drugs, your medicine. So continue with Medicare. Nationally Uniform Federal Program, Title 18 of the Social Security Act. Part A, financed through a payroll tax paid by employers, and the self-employed. Part B, subsidized through general taxes, but the participants pay part of the premium cost sharing, and Parts C and D. For Medicaid, it covers only the very poor. Income criteria established by states means tests. Public welfare, all services are covered under one program. Program varies from state to state. Title 19 on the Social Security Act, financed by the states with matching funds from the federal government according to each state's per capita income. See you soon, and remember to read the book.